Welcome to the Art of Healing. We're at the Australian Counselling Association conference, and I'm sitting here today with Philip Armstrong, who's the CEO of the Counselling Association, and we're going to talk today to Philip about what sort of alternative approaches are being offered in counselling. So Philip, can you perhaps talk about what counselling has been known to be in the past compared to what's happening now?
Yeah, certainly. As everyone's aware, that counselling primarily came from Freud, and that was more the psychoanalytic. And even Freud, during his lifetime, evolved counselling that was known as the talking therapies, psychotherapy. They're all the same. They're all one and the same. And it evolved even during his lifetime. He changed his definition several times of what he saw it being, and then he went on from one of the person who he mentored was Jung. Jung went more into dreams, interpretation of dreams, and it's moved on through Viktor Frankl and up through the ages. And now, particularly in Australia, counselling is very much what we call holistic, in the sense that it is reasonably rare to find a counsellor that comes from one modality, because the issue is we're dealing with human beings, and one size fits all. Doesn't work with human beings. And so we have to work with people's cultural background, their socio-economic background, their education. Belief systems is very big, whether it be a religious belief system or whether it be an alternative belief system. We have to be able to work with all those sort of systems without being judgmental, and to do that you have to have a knowledge of several different modalities to be able to ensure you do the right thing by your client. So we have moved from being strictly into psychoanalytical, even when we look at Rogers, which was more about listening and empathy. We know that listening and empathy helps, but we know that it doesn't resolve things. So we've moved on to that, on looking at formal processes, how we move through not just the storytelling, and that's very important, but what do we put in place to form action for change.
Okay, really interesting. I'm really pleased to hear you talking about storytelling. The other thing that I think I'm particularly interested about through the magazine as well is that obviously as a human we have five senses, so starting to hear a little bit more about how language isn't the only way that we can express ourselves, and how counsellors are finding out more about some of these presenting issues that people have, like anxiety and depression, through other means aside from language. So I was starting to talk to Sam about that,
Yeah,
and obviously touch is one of those things, but then of course probably there's going to be ethical issues that will come up.
And touch is one that we stay away from because of particularly if it's a male therapist and a female client. But we have a lot of masseurs who come to learn counselling, because masseurs, hands-on, and people open up and talk, and so they actually learn counselling techniques, and not to become a counsellor, but so they can actually respond to their clients more appropriately. Hairdressers, another profession who, because of the touch, their clients open up and they tell them extraordinary personal things. They don't know how to respond. So there's not just counsellors, as in the ones who, such as me, a professional counsellor who works as a counsellor. We have a lot of people who come from other professions who learn counselling so they can respond because of touch. So even though we don't do it, there are a lot of people who understand the significance of touch. But counselling has significantly evolved in, it used to be called the talking therapy. We can't call it that anymore, because we now use music. So hearing as opposed to verbal. We use colour therapy, so again it's visual, it's responding to colour. So there's a lot of research in colour therapy and the impact of colour, and you'll find there's a lot of professionals who do renovations and so on. They actually learn about colour therapy and how colour impacts on people, and how you can use colour to respond. A lot of marketers use colour. So a lot of advertisements are really, firstly they look at is colour, how people respond. So we have responses to colour. Smell, we have aromatherapy. A lot of counsellors will use aromatherapy or oils, so because they know that the human body responds to stimulation of different smells, and we know that impacts on the brain. So counselling is very holistic in that we have to, a counsellor should have a very good knowledge of all these different aspects of the human being and how they work. So we have to know the five senses, not just be able to talk.
And what percentage of counsellors, therefore, would you be saying are practising holistic counselling?
Primarily, the majority of private practitioners are. Now, when you talk about training, the first thing that's implicit with the counsellor training is you must learn the skills and the theory of counselling. So that is what you learn first, the micro skills, how to respond, how to, the whole different things that we have to learn when we're working with a human being to respond appropriately, be able to listen, how to be empathetic, non-judgmental, and all those sorts of things. And look, we know for a fact 50% of Australians use alternative medication. So we know Australians respond very well to the holistic. And if you listen to the Minister when she did the opening of the conference yesterday, she was talking about, she didn't use the word holistic, but she was talking about a system that involves social support, housing, all this. That's holistic. So the government is actually coming into it. They just don't necessarily use the word. They use all enveloping or the different words, but it's holistic, is what they're saying. And when I was talking to them, I was using the word holistic. And she knew exactly what I was saying.
That's fantastic. And so with the Counselling Association, when was it established here in Australia? You're the peak body for counselling?
We are. ACA was established in 1998, but really didn't start progressing as a peak body till around 2000.
Okay, and I think you mentioned you've just come back from overseas somewhere, so you can probably see a little bit into the future as to sort of what the things that are coming up.
Well, I'll tell you what's exciting. If you speak to the people at this conference, we've got people here we've got the President of the New Zealanders, we've got the President of the Canadians, we've got a Director from the UK, we've got people from the American, and this year I've been and met with the board of the Americans, and I've met with the board of the UK, and there's I've had something that worked with the Canadians, and I've been to Hong Kong and met with the Asians. Most of them believe that Australia is way ahead.
That's fantastic.
So,
and do you believe that yourself?
I certainly. I think we're streets ahead in the way we develop and deliver. Where we are behind is probably research. But we're such a young nation, it's such a young profession, that makes sense in Australia that we've still got to do a lot of catch up. We are behind, and this is a message for politicians as opposed to maybe your readers, but we are behind in our health system. In the States and in the UK, you can still get counselling against the national health schemes. So in Australia you can't, although we are working to change that around. So from a political perspective, we are behind. Our government is behind in the acceptance of counsellors and delivering counselling for the community. So we're a bit behind there, but as far as the development of counselling and how we deliver counselling, we're probably streets ahead.
Okay, and the training, so in terms of a counsellor getting that foundational core counselling skills, what training do they go through, and how does that compare to, say, if a person was going to be a psychologist? What's the comparison there?
Okay. Primarily, the biggest difference between the training of counsellors and psychologists is the way that we train. If you do a 3-year psych degree, you don't do any hands-on work. It is all theory. In counselling, you're doing field placements and practicums in year 2 and year 3. So you're actually dealing with people.
Yes.
In psychology, even in their 4th year, they don't. A lot of it is done in their honours or in their masters, where they start to practice. So we do hands-on with people a lot earlier. Psychologists work with what's called a DSM, the Diagnostic Statistical Manual. They're more into labelling and diagnosing an illness. Counsellors prefer not to label, by and large. We acknowledge that certainly there are disorders like bipolar, schizophrenia, that are disorders as opposed to mental health problems. So they do need diagnosing because they need specialist help. Generally counsellors don't work in that area. We work with mental health problems, so people with anxiety, depression, relationship issues, those sort of things. So we don't generally believe there's a need to diagnose people with a stamp saying you've got a mental health disorder at that level. Psychologists generally do, and there's no good or bad about it. It's just that's the difference in the philosophy between the professions.
Well, thank you for explaining all of that. So if somebody presents to a counsellor, is there some sort of assessment that the counsellor will give to that person to determine what level of mental illness they have, and at what point they will then refer on to a psychologist or something like that?
Yeah, generally what happens is counsellors generally don't do formal assessments. That's what psychologists do. And again, that's a departing line between the professions. A counsellor will work with someone for 3 or 4 sessions, and if during that 3 or 4 sessions the counsellor determines that this person has more of a mental health illness as opposed to a mental health problem, they'll then refer on generally to their GP, who'll then look at a mental health care plan to then refer on to either a psychiatrist or a psychologist. But generally we work with people face-to-face, hands-on, and we determine after working with them where that's going, whether we can help and whether we can't. Obviously, during our degree training, we are trained in diagnostics and assessments, but not in the same way as psychologists. So we're certainly qualified to be able to assess and diagnose. If we don't do a formal diagnosis, we would refer, and we would let the GP then sort it out from there on.
Okay, so in terms of the person on the street then, who understands that they have a mental illness, which I guess actually probably wouldn't happen a lot, but I mean in terms of, say myself, and I had an issue, how would I know, how are you accessing these people? How do they know to go to a counsellor, and where do they go to find a counsellor in the area? I mean, how does the actual process work, and how do they know, well, you know, my problem's like worse, so I need to go to a psychologist? I mean, I would sort of be thinking that actually out there in the marketplace there might be a bit of confusion. Is it the GP is still the initial point?
The GP is a gatekeeper in the sense of referring into a Medicare service where counselling currently isn't a Medicare service.
Yes.
We don't use the word mental illness. We try and steer away from that because most people have problems. I mean, let's put it in perspective. It's less than 10% of the Australian population will suffer from a mental health disorder where they need a service such as a clinical psychologist or psychiatrist. That is 10%. 90% of the population will fit more along the spectrum of having a mental health problem or need just social support. And so there's more the worried well, but also people who do. When they wake up and they're feeling depressed every morning, so they need some help. They're being bullied at work, and that's having an impact on them. Their relationship is starting to fall apart. That's not necessarily mental illness. That is just that's the fact of living in life in 2011.
Yes, absolutely.
So that's how we prefer to look at it.
Yes.
So as I said, less than 10% will have a mental health disorder. So the majority of people that counsellors see are just either sort of they require further social support or it's a mental health problem. And you can access a counsellor. You can go onto the ACA website. We have a database of counsellors, where they are, where they're situated, and contact details, and you can contact the counsellor. We do have Medibank private provider numbers for those who have Medibank private. But right now we're working with the government to get access to ATAPS and the Better Access Initiative.
So it comes to whether the GP is thinking, well, okay, that person. I mean, how often do GPs refer to counsellors rather than maybe saying, take this pill, and also responding to what the consumer is wanting? You know, sometimes they actually prefer to be given a pill and not stepping up, you know, for their own responsibility to learn more about their own condition.
To answer that question, I have to be clear. I can only talk from personal experience. I can't talk on behalf of GPs. I'm not a GP. I'm not a member of the division of GPs.
Yes.
But I've done a lot of work with the divisions of GPs. What I can say is, pre-2006, before the Better Access, where the consumer can get access to psychological services through Medicare, the majority of GPs referred to counsellors. Well, after 2006, when the Liberal government brought in Better Access and excluded counsellors from it, that fell off because GPs get paid to write up mental health care plans. So they get remunerated for that, and if they're writing up the mental health care plan, you must refer to somebody under Medicare, which is generally a psychologist in larger cases. So they get paid to write that up, and then the psychologist can then offer a service under Medicare. So obviously counselling from a referral basis fell off. I'm not saying necessarily it's because there was a lack of, because they weren't being remunerated. All I can say is it fell off, and I can understand to a degree because the consumer got access to Medicare.
It's a very interesting area, isn't it? I guess, and this is all because there are just that many more people who are now today still having issues in this whole area.
Modern life is very difficult.
Yes,
we don't have the social support that we used to have. We don't have the tribal system anymore. We don't have the village system. We are a transient population. So we don't have that social support. We have a lot more stress. We work, I mean, we know Australians actually work harder than Asians, which is something Australians don't even realise themselves. A lot of times, if you look at the hours that Australia, we're one of the hardest working nations in the world, and that impacts on social relationships, your personal relationships. It puts a lot of stress. We have the world financial crisis. All these sort of things impact on the individual and create more issues. And because we don't have that immediate support that we used to have 50, 60 years ago, we need people to talk to, and counsellors are the perfect person.
Well, thank you so much, Philip. I've learned a lot from this interview, and I hope you have too. And thank you for inviting us to be involved with the conference, and we look forward to being here again with you next year.
Great, no, thank you.